Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our partners at Monigle, welcome and thank you for joining us in today's webinar. We'll explore a crucial issue for healthcare organizations, the role of culture in attracting, retaining, and engaging employees. Indeed, in the face of staffing shortages, increased competition for quality candidates, burnout, and employees leaving the healthcare industry, culture is more important than ever. Today, you'll have the opportunity to explore culture strategies and best practices with Adriene McCoy, Senior Vice President and Chief Human Resources Officer at Baptist Health South Florida, and Justin Wartell, Managing Principal at Monigle. One note before we begin, attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into our question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. With that, I'll turn over the program to Justin Wartell, who will be leading today's discussion. Justin?
Well, thank you, Daniel, and thank you to everyone taking a few minutes from your already very busy schedules to join us. I'd also like to thank Adriene McCoy for jumping into this, sharing with all of you. I think it's been a fantastic experience over the last couple of weeks of prep as we've dug into some of the topics and content that we wanted to share. Since Daniel did such a great introduction in terms of who you are, Adriene, I'd love to use this introductory page to maybe pose a question to you. And for all the folks that are on the phone, how do you think about culture within your organization? How do you define culture at Baptist Health? And let's start there, kind of to set the stage for today, if we could.
Sure. Thank you, Justin, and thank you to everyone who's participating today. When I think about culture, we always say that culture is the glue that kind of holds everything together. You can make all sorts of promises, both to patients, to employees, to their families, but it's really how people experience the organization, what they feel, some of the unspoken energy that weaves its way throughout every interaction, both visible and invisible, that really defines what the organization's trying to get done and who we are and how we come to this work in a very meaningful and intentional way. So it's really, it's kind of the water that runs through everything, if you will, that really keeps everything afloat. And hopefully that culture is very positive, it's very aligned, and it's very connected. And people can link to it in a very individual way.
I appreciate very much that definition. You used a phrase that I really liked. I think it was yesterday, the day before when we were chatting. It was where you feel culture, you also feel good. And I think in today's world, that notion of feeling good is such a critical element for us all to be considering as leaders. And I think your definition of culture also sets the stage for what we wanted to talk about today. So as Daniel addressed in setting up the importance of this topic, nobody will dispute the incredible challenges that are being faced by each of you, by your frontline staff, by any employee working within this healthcare space. We have not only the challenges of individuals leaving our own organizations, but leaving the industry as a whole. It's arguably unprecedented. And with that in mind, what Adriene just described is that definition of culture. I think so much of what we can do is about understanding our brand and our culture and how we can bring that to life for people and provide them with that sense of positive connection that ultimately leads to a deeper level of engagement, a deeper level of satisfaction, and ultimately a reason to continue to stay not just with our organizations, but within the industry as a whole. That really sets the stage for how we were thinking about today's objective. What we're hoping to do in our discussion today is share with each of you some of the insights that we've learned, and more specifically, how those insights translate into best practices, some tangible messaging tactics, and filter them through some of Adriene's depth of experience, about 30 years in the healthcare world, and use some of those learnings and those experiences to empower you all with actions you can take as immediately as tomorrow in some of the work that you're doing and the interactions that you're having with your colleagues across the organization and trying to keep people connected. So with that objective in mind, let's start with a question. So we'd ask all of our participants who have joined, open up your chat if you would, and switch that little to drop down to everyone so that you can share your answers publicly. How would you each answer this question that's on screen? What do you think attracts the majority of candidates to your organization right now? And what are some of the things that get in the way? We'd love to just get a perspective from, there's such a diversity of both geographies, organizations, even departments perhaps that are listed here. Seeing some of these answers start to come in: mission and values, our reputation. The reputation is a really interesting one. Adriene, I'd love to pose a question to you. How do you think about reputation in the context of culture?
Well, thank you, Justin. Every time I think about reputation, I think about the promise that is made on what you're going to experience and whether or not it actually occurs, right? So, if I think about organizations that I've worked for, in some instances, you interact with people in the community and they talk about the organization either in a positive or a challenging way, and that starts to permeate, because people share stories. They either share positive stories or they share challenging stories, and that starts to create a narrative around your brand, around your organization. And it's well beyond just the customer. It's even from an employment perspective. Is that the type of organization that I want to work for? Do I want to be connected and tethered to that organization? Obviously, those organizations that have a great reputation, even though everyone has challenges with staffing now, those that have great reputations have less challenges because people want to join in. They want to be a part of that. And having a great reputation is kind of a blessing and a curse, because once you've got a great reputation, you've got to sustain it. You have to sustain it with every interaction, whether it's with your employees, with their families, with the physicians. So it's everything. It really, really is. And that reputation is either built up or torn down every day, with how people experience your organization.
I think your comment, Adriene, gets at something also that's embedded in a lot of the chat comments here. This notion of the continually graying borders or boundaries on all of these things: culture and reputation, our people in comparison with the people we serve. How do all of these things connect together? And I think probably serving as an undercurrent to everything you're seeing today is this assumption that we tackle culture, we tackle reputation, we tackle mission and vision, which was mentioned by a number of individuals in the chat. We tackle all those things as a collective leadership group. It's not the purview of one department or another. It is about how we're collaborating together. And we're going to talk a bit more about that aspect of collaboration and connection across the enterprise as we get into more of the content today. So thank you to all who weighed in within the chat. If you have any other comments or thoughts that you want to share there, please don't hesitate to drop those comments or questions into the chat. Our folks will pose a few questions along the way as well in case you want to weigh in. So let's talk about our roadmap for today. Where are we going to go over the next about half hour of discussion and really bring into life some of the expertise from Adriene's experience and the work at Baptist Health? Well, we'll first set the stage with a bit more data around maybe more the positive side, the things we don't necessarily spend as much time on in terms of the employee perspective, because we're spending so much time figuring out these challenges. Then we're going to tee up 3 specific best practices, 3 things we learned from our research into this intersection of brand and culture. And for each of those, we'll share some data points. We'll share some best practices from individual brands and how maybe some folks in healthcare and outside of it bring those best practices to life. We'll get into some specific tactics, actions that you all can take, and then we'll leverage Adriene's experience to share a bit of how we could potentially translate those into our healthcare world. We'll save some time, as Daniel mentioned at the beginning, for questions and discussion. If you have any specific questions, feel free to drop them into the Q&A, and we will address those either in line or at the end of the organization. I'm sorry, at the end of the presentation. All right, let's set the stage if we could. One of the things that we wanted to essentially remind everyone around, we conducted some research among both clinical and non-clinical healthcare employees last quarter. In fact, this was just before the holidays, and it is pre-Omicron, so I want everybody to be aware of that. So things continue to shift very quickly, not any news to you all. I think it's important to call out that there is still this orientation among people working in healthcare that this is more than a job for them, that there's this orientation to a deeper meaning and a deeper potential for satisfaction and connection. So while we do struggle with incredibly high levels of turnover, of new challenges around the treatment of our staff by the folks walking through our doors that we're trying to help, by the competition that we've unintentionally created internally, maybe if you think about nurse populations and traveling nurses versus our legacy staff, there's still this orientation that people have to this job being something that's more than just a job to them. And the source of that energy or that perspective comes from, we lifted a few of the open-ended comments, this notion of feeling proud of your contributions and the impact that you're making. And this continued orientation to, I want to be celebrated, I want to be acknowledged, and create a sense of value and worthiness for the contributions that I'm making. So when you think about the individuals that we're talking about here, when we consider some of the opportunities that we have, there is still some positive nuggets here that we can amplify. I know oftentimes we spend a lot of time on the negative, on the business challenges that we face from a recruitment standpoint. So what we wanted to do in order to see how we could understand and maybe amplify some of these opportunities is look at how healthcare organizations can put their best brand forward throughout the recruitment journey, throughout the experience that employees have with us, and think about those practices in the spirit of attracting and then also retaining the best employees possible, especially in this ultra competitive market. So that was kind of the question that underpinned some of our exploration, the results of which we're going to share with you all today. Our work then jumped in to a series of in-depth qualitative interviews with a variety of organizations outside of healthcare. Purpose Fused, which is a consultancy that focuses on purpose and people and the intersection with performance. Gymshark, which is a consumer brand in the fitness and apparel space that thinks about the consumer experience and applies a lot of those principles to the employee experience, especially at the recruitment level. And then Vail Resorts, a leader in luxury travel, the organization that oversees and guides epic experiences on mountains all over the world. So a variety of perspective that we're going to share and then work to translate into more of a healthcare context in our discussion today. So with that, we'd love to jump into those three best practice areas. Now, we realize that not every organization is at the same place in terms of how you all, many marketing leaders, as well as maybe HR practitioners and experts that are here, not every organization is at the same place. And we want to acknowledge the spectrum that can exist. When you think about the relationship between our marketing teams and our HR teams, we alluded to this, and Adriene addressed it pretty directly, this notion of how do we connect all of these pieces together, this our collective responsibility. At one end of the spectrum, we still see siloed departments that don't necessarily communicate with one another. In others, we see a much more interconnected experience with some aspects of HR capabilities, of recruitment and culture being either part of marketing or vice versa. So as we pause here, and my colleague Kim put a question into the chat if anyone wants to weigh in, but Adriene, as you think about where organizations can be here, how do you think about helping organizations to move toward that more integrated and connected, in sync type of approach? Anything that you've learned along the way?
Sure. It actually started for us several years ago when we were growing as an organization into new markets, trying to make sure that we could extend our culture to the new organizations that we have partnered with. And we decided to do exactly what you're saying. We partnered with patient experience, HR, and marketing together to evaluate what's the status of our brand, what's the status of our employee value proposition, what's the status of our patient experience, and really looking all of that data together to determine what is our story, where are the disconnects, where on one hand are we making a promise or we're predicting an experience, but it's not following through because we haven't connected the dots, not just for our consumers, but also our internal stakeholders. So we started to look at how do we hire people? What do we say to a candidate through our recruitment marketing before they even come in? Is that consistent with what we're saying to the consumer? Is that consistent with what we're telling our employees in terms of how they can develop and grow in the organization and be engaged, and what we expect from them in support of that patient experience that we want to provide? So I recall, and you mentioned the pandemic and what's happened in the last couple of years. We actually had a leadership summit back in February of 2020, and that was actually before all of the variants were upon us and everybody locked down. And we took the entire organizational leadership into a room and we discussed just that. What are those intersections of culture? What do we want to be and provide as an organization? And we had worked on that for about 6 months' time, getting together in a room, my marketing partners, my HR folks, and the folks in patient experience. And we spent a lot of time having those discussions, talking to leadership to come forward with a collective idea of how we were frankly going to be all in for providing the best experience for anyone that interacted with our organization. It was very intentional. It was very specific. I can tell you that over the last 2 years, as we have continued to try to keep that going, with every variant, it's been very, very challenging to kind of keep that narrative and that work going on, because you pivot back and forth between crisis mode and what do we have to do now? But when I talked about culture at the beginning, one of my greatest fears is that if you don't manage that, if you don't work on that narrative and make sure that you understand where your folks fit in and how they feel and whether or not they feel connected to that, if you're so busy in crisis mode, you could look up 2 years later and have a very different culture. You also mentioned the fact that we've got a lot of travelers in the organization. So we used to have this stable workforce without a lot of contracted staff. And now you have a bunch of other voices that aren't as connected to us in that meaningful way because we didn't recruit them. They're coming in contracted, sometimes sight unseen, and that has an impact as well. So the connection of marketing, PR, HR, and patient experience, I think, is critical for health systems today.
I think there's a lot embedded in what you were describing, especially related to this notion of it being a we challenge. A lot of what you were describing is that the organization took on that collective solving of the culture question, or at least addressing the culture question. I think if I was watching the chat comments, and a lot of folks were talking about different where they are on the spectrum, opportunities to improve. There's probably one really meaty takeaway, Adriene, what you were just describing, and that's we have to make culture a we thing as opposed to HR's thing or recruitment's thing, or even just expecting that culture can thrive only with the actions of people within specific teams or at a frontline level. So we have to make it a collective problem and opportunity. So with that, let's jump into topic number one here. This is one of three, and we'll share with you a little bit of the data as well as some of our learnings, some tactics, and then a healthcare translation. It's related to this notion of rallying around purpose, and this won't be something that's surprising to many of you, but how we do it is what's a little bit surprising and may offer opportunities for action. I think there would be likely no debate from anyone on this call or many across maybe our C-suite audiences and peers that purpose has become fundamentally more important to every type of job that we might consider as employees. And I think in healthcare, we're seeing that it continues to emerge as something that's expected. The research that we conducted talked about how important it was for employees to say that the organization that they work for has to put people before profits, has to prioritize purpose. And so we have to understand then what kind of purpose and what ideas relative to purpose our people want to connect to or connect with. So when you think about the opportunities here, if we look at best practices from outside of the healthcare space, in speaking with Vail Resorts, what was interesting is how purpose for Vail is about the connection point to a communal passion. Part of what unifies and connects people that choose to work for Vail, especially among their seasonal staff, is this idea of passion for the mountains and the outdoors and the epic experiences that they can have around it. So when you think about that bond, that becomes that connection point, that communal feeling becomes the glue that serves as Vail's culture. Adriene was talking a bit about that glue a little earlier. So when you think about what is that shared idea that connects people, what is that communal feeling that brings people together, and how can we build aspects of our culture and our brand and our experience around it? Another example that we thought was interesting, this is that iconic Patagonia ad where they came out. This was Black Friday 2011, something that I think this still gets referenced. Well, we're referencing it today, so here you are. But this was a communication from Patagonia that said, hey, for the sake of our environment and in the spirit of our sustainability goals, don't buy this jacket. Now, that's a very counterintuitive idea. I think this has manifested in healthcare. I think there was a series of ads about empty hospital beds and say, we don't want you here. Don't come to our hospital, or something close to it. But what this was a communication around a bold interpretation of purpose. There's an organization so passionate about sustainability that it said, don't buy a new jacket, repair the one you have. So when you think about the opportunity relative to purpose, there's an expectation also that we as leaders speak and act boldly around our purpose. Now, contingent upon doing these things is contingent upon one really important truth, and that's, do you all have a purpose that inspires you? And is that something that the organization has rallied around? There's an origin question that we would want to get to there. But two opportunities we see when thinking about purpose and how people connect to it. One, how we connect to that communal passion. And then two, if we learn from Patagonia, taking very bold stances. There's a boldness that's expected in a lot of what we do. Let's go a bit deeper. How do we start to bring this to life more tactically? What are things that we can be doing differently tomorrow than today in the spirit of purpose? Well, how do we incorporate our purpose-related language and the signals around it within our equal employment opportunity language and statement? How do we think about that brand purpose connecting and expressing DEI and B initiatives, which many organizations have worked to stand up at ever faster rates, especially over the last 2 to 3 years? Where does our purpose live? And how often are we talking about it? Do we post our purpose? Is it out there in a job post as we start to think about that recruitment story? There's a very bold and aspirational purpose listed here as an example, but think about what would happen if we led with that kind of insight, with that sort of perspective, with that point of view in some of the interactions that we're having. Lastly, focusing on impact, because oftentimes purpose can feel a bit abstract. So how do we show impact? And then the context that we were using here, again, in the spirit of recruitment and retaining employees, how do we frame what people are doing through the impact that they can have, not just through the lens of some of the things that they would do as part of their job. If people connect, if we believe that people are connecting with purpose at a bigger, broader level, demonstrating how individuals can impact that purpose can feel more significant and more meaningful for the individuals we're hoping to recruit, and can celebrate and re-amplify the reasons people are doing it on our behalf. So let's take a pause here. I'd love to open it up, Adriene, to your perspective. When you think about purpose and some of the tactics outlined here, what are some of the things that you and your team have been able to do around purpose at Baptist Health?
Sure. When we think about purpose, sometimes you think about healthcare and you just think about it in a very basic manner, that we're here to take care of people and we're here to help them become to be healthy and to thrive and so forth. But it's really so much bigger than that. From a Baptist Health perspective, you see the pineapple, that's a symbol of hospitality. Our purpose is not only to take care of people and make sure that they recover well, but that they feel comfortable, that they feel welcome, that they feel as though the people here care about their well-being as well as they do their own family members. And that's something that we speak to our employees about. That's something that we recruit on. That's something when we think about connecting to making those decisions as to who is going to support and fulfill that purpose from a cultural perspective. We ask very probing questions in the interview process so that we can call out those folks that it won't be a hard sell. The worst thing you can ever do is recruit someone and try to get them to help people feel welcomed and cared for, and they can't do it because it's not their interest. I thought about a scenario actually yesterday. I had a family member that was in the hospital last week. We were there from Tuesday to Friday with a follow-up yesterday, and we went into one of our hospitals. We were in the elevator, and there was an employee that also got on the elevator, and I didn't have on my badge. They didn't know who I was. And that person had a vested interest in making sure that we were getting into the right location. They knew that the family member was walking very gingerly, didn't really need to walk all across the hospital and be in the wrong place. It's our flagship hospital. And they actually took a moment to validate that my family member was on the right elevator. Are you sure you're going in the right direction? And that was something you really can't train to. That's someone who understands why they're there, wants to make sure that people are cared for, that they're getting the support that they need. We try to reinforce to our team, if you see someone walking in the hallway and they look like they're not sure where they're going, take a moment, walk them to a certain area if you have to do that. And all of those aspects, it's not rhetoric, it's not propaganda, it's not just things that we say to get you to come and work here or to get Baptist Health to be your healthcare organization of choice. It is so deeply intentional to make sure that the purpose that we have for being in this community, for trying to make sure that our workforce is healthy and engaged and that they have a good sense of well-being, but also more importantly, that is what we have to focus on so that they can look outside of themselves when they're interacting with the patient. Just one more thing, when I was thinking about the individuals that took care of my family member last week, even someone coming to take a food order, and the interest that they had in making sure, that the person was getting all of the different elements that they needed, and doing that not just in a tactical way, because, you could fill out a food order and say, okay, I walked out, I got what they needed, but actually doing it in a way that says, I care about you being here. I realize this is a disruption to your life, and I want to make this as comfortable as it can be. No one wants to be in the hospital. And starting with that lens of, we're going to do our best, to making an uncomfortable situation as comfortable as it can be, and continuing to reinforce that, and actually getting back to why people come to work. Yes, they come to work to get paid in order to make certain decisions of their lives, but they also have purpose. Each individual has purpose, and they want to feel like the work that they're doing adds value in some way. So those linkages from sourcing candidates, recruiting, onboarding, assimilating, training, reinforcing, making sure that we are hearing from our employees, are we meeting your needs, your purpose? Are we connecting you to opportunities to walk away at the end of a shift and feel like you fulfilled your purpose as an individual as well?
Adriene, I'd like to pose this is a hard question alert, but it's coming in from two individuals, and very similar idea. And I think it's the reality of the challenges that leaders like those on this call are facing. What if your purpose has taken a back seat to keeping the doors open during the pandemic? If it has, and I'm now adding to just my interpretation here. If it has taken a backseat, how do you bring it back forward? There was a similar question in the Q&A, keeping the organization focused on culture, or I'm adding, or purpose, while departments have been in crisis. Are there any best practices you've been able to deploy, your colleagues have deployed at Baptist Health, that have helped keep purpose closer to front of mind in this incredible period of crisis?
So I can acknowledge, and I think even our executives would acknowledge, that over the past 2 years, it has been very difficult to do that while you're trying to deal with very high volume of COVID patients, staffing challenges, compensation challenges. One of the things that is very, very important, and I talked to colleagues around the country, and there were numerous debates about, in all of these crises that we've had, and I think there have probably been 4 waves of this, if you will. I can think about in South Florida, we've had hurricanes at various times, right? You pivot to the crisis, everybody focuses on the crisis, we're all in for it. And then when it's over, we rally around, we reinforce, we high five, we celebrate how we came together and we made it. Unfortunately, in the past 2 years, that we made it is short-lived before we have to do it again. So, you try to find ways to make sure employees know that they're supported, make sure that they know that they are cared for as they are dealing with challenges. And I'll be frank with you, from an HR perspective, as you've had to bring in so many contract staff, so many people that you've not had that time to build strong relationships with, and your own staff says, wait a minute, okay, if there aren't enough of us, you can just go get a busload of other people that may or may not as qualified, as engaged. So it's been a significant challenge throughout this whole pandemic. On a quarterly basis, we have continued to do our engagement surveys for our employees on a quarterly basis. And some would say, why would you do that? Where they're in crisis, they're going to be upset, they're stressed. Well, we've done it anyway, because we need to understand what are the challenges, and what are some of the challenges right now. People being able to disconnect, people feeling like it's never going to end, feeling despondent, feeling frustrated. All of those things challenge culture. All of those things challenge your ability to keep the narrative of a great organization going. That's the reality. I can't tell you we've solved it and it's perfect and everybody, it has been a struggle to keep that going. I'll tell you the number one reason that becomes difficult. I can't think of any other crisis where everybody in the country for 2 years has been impacted by this in some way. I can't think of anything that has been that sustained over time. And leaders, think about leadership. Your frontline leaders are the ones who are supposed to take that employment promise, that development and purpose promise, and keep it going. And guess what? They are burnt out, right? They're tired because they've had to be managers, leaders, coaches, counselors, crisis responders, creative solution folks. It's all come at them at the same time. So how do you deal with all of that? It's really harnessing that data and that information and saying, how do we thank people? How do we continue to round? How do we become very transparent? We've done more town halls about the reality of what we're facing on a consistent basis, because if you go dark with your communication and what's happening, things will start, narratives will be created on their own. And we actually are in the midst right now. For this quarter, we decided we're going to drill down on leader burnout, on leader stress, because they're the ones that we need to keep the staff up. So if they're not feeling good, then wow, we've got a major, major problem. So I'll tell you, it's been difficult. We've had many conversations about it. There are starts and stops. I did mention to you that in February 2020, we had this great big conference and we were ready to go. We had toolkits, we were going to cascade. And guess what? March 2020, everything got shut down. So plans have been changed, but we continue to say that we're going to keep at it. We're going to do it entity by entity, leader by leader, department by department. And, you know, we talk about the light at the end of the tunnel. We don't know when this is going to be over. So we've got to keep talking to our folks, keep finding out what their challenges are, keep reminding them about what's great about being here. And the money conversation has become the loudest noise from a workforce perspective. You know, people saying, if I'm going to work extra shifts, you're going to have to pay me more money. And in my 30 years of HR, this is the most challenging time we have ever faced in terms of keeping culture at the forefront, keeping the experience where we want it to be. And you just can't let up. If you let up, that narrative will be very different and it'll be very hard to try to get things back on track. So I feel very proud of the fact that we were collaborating with marketing and patient experience well before the start of this. But right now, I can't imagine a healthcare organization that's not doing that, frankly.
You're getting some very vigorous agreement, Adriene, to a number of the comments you made throughout the notions of those money questions. I think what was interesting in what you were describing is this notion of throughout this, we've tried to maintain our orientation to listening. There was some work that we heard about from Johns Hopkins. That's something that they've done really effectively, is build that very natural and authentic orientation to listening. Because at the end of the day, that maintenance of hearing and being able to potentially take action is critical to keeping people connected. Let's keep going if we could. We've got two more topics we want to talk about in our discussion here. The second one is all around this notion of belonging to a culture. I think if we've defined purpose as that anchoring idea that starts to frame out what our culture is about, how do we then create a sense of belonging to that culture? I think when you think about belonging, especially in this last couple of years period of disconnection, of maybe a less human set of interactions that we have, we know that people expect and are seeking ways to belong in ever different ways. So when you think about, you know, whether it's employees wanting to feel like they can help and support one another, and to feel like they're in it together, or that their ideal job is all about feeling warm and welcoming, which are feelings that are associated with belonging. We know that this notion of belonging is central to people. So how do brands outside of healthcare address belonging. One of the things we learned in speaking to Gymshark was how they treat the recruitment of employees and the orientation to recruiting employees in a very similar way that you think about recruiting consumers into your brand, thinking that everyone you're interacting with offers the opportunity to potentially become an employee in the future. Adriene mentioned that in some of her earlier remarks around this idea of at some point they could all become an employee of our organization. So if you think about treating employee recruitment through that lens, that every individual can either become a consumer of our brand and every consumer of our brand could potentially become an employee, it starts to again further blur those lines, propel the importance of marketing and HR collaborating in an integrated and connected way, and offers the opportunity to invite people into this community from a very early point in their experience. The other example that we thought was interesting and illustrative here was Spotify. And when you think about Spotify, this is around how employees, in their case, are connecting through music, which is that purpose that guides and connects Spotify employees. When you think about the employee base, it's viewed as their band. So you're starting to perpetuate and connect people into this community in a way that ties back to their purpose, that first topic, but also puts us in a position where we're thinking about individuals from the beginning as part of something bigger, as connected to a bigger and a broader community. So let's look at a couple of the more specific tactics before we pass it to Adriene to talk a little bit about community and this notion of culture as community. Helping candidates to see themselves within the organization, welcoming people as future employees. There are some organizations, some more famous than others, that have names or coined language, vocabulary associated with what employees are called. Hooligans at Hulu, Pinployees at Pinterest. If you think about those sorts of language choices, that kind of vocabulary, that invites people into this discussion at whatever stage they are in the employee journey. How do we look at being more future focused, thinking about that our commitment is to your long-term orientation and success, career planning? There was a comment in the chat around money being everything. And it is an incredibly loud dialogue right now. We recently did some research among nurses, both nationally and within a particular geography. And while money was the number one thing, there were a series of other elements around career planning, around benefit choices that can have a direct impact. And it was interesting to see that while money is a very loud item here, the orientation to being future focused has the potential to connect. The reflecting pool is what we described as this third item here, using inclusive language to ensure that people know that they can be a part of this organization and can feel comfortable and psychologically safe joining the organization. We have a before and an after example listed there. And then lastly, sharing insights. How do you help people to understand something unique about the organization? How we can share something about what we do that might be different. Maybe it conveys our purpose. Maybe it conveys the community that they're joining. But what it helps to do is say that you are a part of this, even if you haven't signed on the dotted line yet, so to speak. That's how we start to create those notions of community from an employee perspective. I'll take a quick pause here and pass it to Adriene. Tell us a little bit about how you build community at Baptist Health as a part of this broader contribution to culture.
Sure. When we try to build community, we think about our workforce and our employees as being not just individuals that are coming to do work for us, but actually, individuals that use our services themselves, for themselves and their families. So we try to look at it a little bit more broad, try to think about how we can make things as seamless for them, how we can support them in every way possible. And, when you mentioned how some of these organizations have coined different nicknames and things for their employees, you have to not be afraid to market the experience to your own employees, not just assume because they're here and they haven't quit, that they're fully engaged, that they feel like they are a part of this. So we do everything from on a quarterly basis, we have these what we call Pineapple Proud activities, where employees get an opportunity to show a little bit of individuality. And we've continued to do that even through the pandemic. If you think about well-being, for example, a lot of people get encouragement and comfort from their pets. So there was a time a couple of months ago where we had people taking pictures with their pets and submitting them and talking them about them and having a contest. And you say, you know, why would you do that in the midst of a pandemic? Well, we know that people use their pets sometimes emotional support. Think about individuals that are remote and were thrust home, didn't necessarily have the support of their coworker to build that community. So how do you get them involved? How do you get them continuing to participate despite the fact that things are different now? Things are challenging now, they're different. So we try to make sure that we're continuing to talk to them, continuing to engage them and hear from them. One of the strategies that we engaged with very early on in the pandemic, when things were very uncomfortable and unknown, we had employees, we were sourcing stories, personal stories from employees. And every Monday morning, you would see the video of the week. It was only about 2 minutes where an employee would be sharing their story, either how their family member was cared for or how when they were sick, their peers helped to support them. And we did it on a trial basis. We said, you know, we got to do something to try to keep people inspired and engaged. And you would not believe the responses that we got from employees. You know, that was very touching. That helps me feel like I'm in the right place. It was stories with individuals that they didn't even work with, that they didn't know, but inspired them that the organization was doing the right thing. We engage leaders, even in leaders of telling stories and being vulnerable, walking around, telling people their own stories of challenge, their own stories of the unknown and their families. And it made a difference. There's a level of openness and vulnerability that I think all leaders have had to show, to say, I'm dealing with this too, not in a complaining way, but in a way of connecting and supporting one another. So, you know, from a community perspective, for many years, I've had people say, this is the organization I've wanted to work for a long time. And I would probe on that. Why is that? You know, there are a lot of other places. Tell me what was different. Well, I remember sitting a few years ago in a hospital room, and I saw how the staff took care of my mother or my father, and that made a difference. I wanted to be a part of a place like that. And those are those stories that you really have to be reflective of and say, how do we continue to make sure that that happens? You know, at the bedside is not really a recruitment venue, but you are quietly letting people know this is a great place or it's not, right? Going back to that promise, going back to what we've said we are, and making sure that we're living that every day. So we try to stay connected. We try to get our leaders to be transparent when things are going well and when they're not going well. You know, whether it's in a huddle. I was the other day we talk about money. I was on a town hall with our technology folks, and I was explaining to them what we have had to do financially as an organization to support the response to COVID. And, you know, with that, when you hear us talk about extra shift bonuses for clinical staff and so forth, I want you to understand why that is happening, why we are doing that. That is part of being transparent as a community and saying, you hear these things, you may not understand it. You may wonder why you're not getting those same bonuses. Well, let me tell you why. The priority for us as a community right now is helping to restore the health of the people that we serve. That doesn't mean that your job is not as equally valued. that means that that's the focus that needs to be our highest priority. And if we don't do that well, we're all at risk. So how do you have that, whether or not the majority of the people agreed with that, or some people walked away and said, it's all about me. And that's great that she said that, but you know what? We got to talk about it. We've had our CFO in certain forums being very transparent about what this means. If we delay surgeries, if we do these things, what does it mean to our finances? Employees want to hear that. They want to know, they want to understand. They don't want you to hide it. And if you don't do that, you're not building community. You're allowing some other narrative to be created when you're not looking. And, again, it's all about managing this relationship throughout the entire time.
I think those are great examples, Adriene, and they really get at the orientation to treating our collective culture as a community with shared values and an orientation that we are in this together. I think just for the sake of time, let's move, if we could, into our last topic here. And you actually teed this up in the last part of what you were just describing, this notion of treating culture like marketing. And this is intended to think about a reframing of how we would approach, celebrate, amplify, express our culture out in the world. When you think about how people respond to organizations, how they respond to communications, especially around job opportunities, the thing that they're looking for is an increased frequency of interaction and engagement. The orientation to seeing and experiencing the brand across social channels. And oftentimes we don't leverage the full capability of our marketing teams shoulder to shoulder with our HR teams. And there's nothing wrong with that. In fact, there's an opportunity here to really leverage that capability. And you see it in some of the best practice examples that we explored. We saw Gymshark, for example, really thinking about threading their values into their communications and taking a more creative approach to storytelling. The importance of feedback to see what was resonating and what was not. And apologies for the pace, just want to make sure we give Adriene an opportunity here to close us out on this third topic. Empathize with the challenges and the opportunities of recruitment. We know that finding a job is challenging, especially as HR teams and recruiters are buried. One of the things that was interesting, using Airbnb as an example here, is really thinking about how you segment those candidate journeys and understand where people are in the process, and that we likely have to take different action at certain steps in the journey compared to others. Again, that's bringing that marketing, that very natural marketing orientation from the consumer journey to the employee journey in order to leverage the capability that many on this call absolutely have. So a couple of quick tactics before we pass it, Adriene, over to you for maybe about 2 minutes or so. We've got this idea here of going beyond the resume. How do you build interview questions that really start to think about how people express things that are a little bit less expected? Bringing in a more casual orientation. Do we have our recruitment tone of voice established? Do we have our employer brand tone of voice established? And how, if at all, does it modulate from our broader brand tone of voice? Can we put ourselves in the shoes of our recruits? Have we ourselves brought some of that direct experience of applying to a role, of really putting ourselves in individual shoes? And then also taking the opportunity to really use our team members, our employees now, as amplifiers of our recruitment message, especially with these direct connections. So I don't mean to shorten the great insight that you were going to share, Adriene, but for the sake of time, maybe if you take a couple of minutes and share some of your experiences treating culture in a marketing way, and then we'll close out for today.
Sure. We started a number of years ago. I've known for many years that you can't just post positions and pray that people show up. You've actually got to take the same approach that marketing uses to inspire people to want to connect with your organization. So we have taken the approach that when we are marketing to candidates, we are doing it with the same level of energy that our marketing team is doing with the consumer brand. And that's everything from look, feel, videos, everything. And we've been very aligned with marketing on that. We make sure that everything that we do is connected, that they feel comfortable with what we're putting out there when we are videotaping groups of employees to say, talk about your experience in this role, because we want to post this on Facebook. We want people to see what it's like at Baptist Health to be a phlebotomist and hear from a phlebotomist. There aren't enough words that we can write to truly inspire people in that way. So why don't we do these videos? Why don't we have people hear from those that work here? And all of those strategies, we have a very, very robust recruitment marketing team that is connected to our folks, whether it's LinkedIn marketing or what have you. And we take this approach that we want you to want to be here. We want you to feel like, wow, this connects with my values. Anybody's going to be able to give you a job, show you the job requirements. Okay, I have those. But then you start to look at what distinguishes us as an employer brand and as an employee experience. Is this going to further my career? Is this going to be a place where I feel like I belong, where I feel like I can thrive? I can't risk, maybe you're going to figure that out about 3 months in after you get here, by happenstance. We've got to create that. And then we have to make sure that that rings true once folks come in. So it's a very intentional, very connected process. We've tried to operate more like marketing than traditional HR folks for that reason, in order to inspire people to be a part of this pineapple community, if you will.
I love that example, because if we circle back to that spectrum, one of the most direct ways to move a little bit further to the right is to figure out how we as marketing leaders can bring our brand and our expertise and our capabilities to our colleagues in HR, to our recruitment engine, and help it to work more effectively, to reach a bit further. I know in the course of our discussion today, we've gotten to address a lot of the questions that were raised. As we close, if there are any other questions, please feel free to drop them into the chat or into the Q&A, whatever is easiest. And Adriene and I can follow up with any answers there. Just want to be conscious of time here. We've put our 3 takeaways from today, which try to distill down to some of the actionable items that you all can be taking away, but appreciate the feedback and the questions and the comments. And Adriene, I just would like to close today thanking you for the opportunity to spend a bit of time digging into these topics. It was absolutely informative, incredibly helpful, and very much appreciate you sharing your experience and your insights with all of the people here.
Thank you. My pleasure. My pleasure to do so.
So as we close today, as the team mentioned in the Q&A and I think in the chat, the recording will be available for everyone, as well as the slides. We'll be able to get some of the chat content and questions out as well. Please take a minute, if you would, to fill out the feedback and share any comments with us. Again, we appreciate you all taking the time out of your very busy days to spend it with us, and look forward to continuing this conversation. Thank you very much, everyone. Take care.
Thank you all.